Hello, dear colleagues. Thank you for inviting me to this conference. This time, I'm going to talk about possibilities of placental therapy for post-acute COVID-19 syndrome. Introduction. The COVID-19 pandemic has caused unprecedented health, social, and economic crisis worldwide. However, to date, there is only a limited effective treatment for this disease. First of all, let me show you the paper entitled Antiviral Effects of Human Placenta Hydrolysate (LINEC) against SARS-CoV-2 in vitro and in the ferret model. In vitro. Briefly, SARS-CoV-2 infected cells were treated with different concentrations of HPH, LINEC, and inhibition of cytopathic effect, CPE, was visually observed using crystal violet staining. The CPE inhibition assay revealed that HPH treatment reduces SARS-CoV-2-induced CPE in viral cells at both a 50% dilution and its original concentration. CC column refers to cells without treatment and virus infection. The virus control VC column refers to cells left untreated but infected with virus. In the ferret model, the infected ferrets were injected with HPH 4 milliliters per animal by intravenous injection on every 2 days, compared with the PBS-treated control group. The ferrets, its respiratory structures are similar as humans, treated with HPH or remdesivir, showed significantly reduced body weight loss and earlier recovery to their initial weight. Infectious SARS-CoV-2 was detected in nasal washes from all groups until 6 DPI. DPI means days post-infection. However, the HPH and remdesivir treated groups showed significantly lower virus titers than those of the PBS control group at 6 DPI. Discussion. HPH is a human placenta extract, which is a cocktail of biologically active compounds, including various peptides, growth factors, amino acids, antioxidants, vitamins, minerals, etc. Thus, such multiple components could exert multiple target mode of action for antiviral activity as well as the induction of type 1 interferons. Post-acute COVID-19 syndrome, known colloquially as long COVID. The NICE, National Institute for Health and Care Excellence, guidelines on managing the long-term effects of COVID-19 and the CDC, U.S. Centers for Disease Control and Prevention, define long COVID patients or COVID long haulers as individuals with ongoing symptoms of COVID-19 that persist beyond 4 weeks from initial infection. The symptoms of long COVID include fatigue, dyspnea, cardiac abnormalities, cognitive impairment, sleep disturbances, symptoms of post-traumatic stress disorder, muscle pain, concentration problems, and headache. Numerous symptoms of long COVID have been reported and attributed to various organs, such as heart, brain, spleen, liver, kidney, pancreas, lungs. an overview of which can be seen in Figure 1. Fatigue. Fatigue is a common persisting symptom regardless of severity of acute stage of COVID-19. In long COVID, fatigue is one of the most reported manifestations, which with the Office for National Statistics in the UK estimating the 5-week prevalence of fatigue to be 11.9 among people who have had COVID-19. Let me introduce the paper entitled Human Placental Extracts as Subcutaneous Injection is Effective in Chronic Fatigue Syndrome, a multi-center, double-blind, randomized, placebo-controlled study. A total of 78 subjects with chronic fatigue were randomly assigned to either a HPE group, blinded group, or placebo group. The HPE group, blinded group, including 19 chronic fatigue syndrome cases and 20 idiopathic chronic fatigue cases, was treated with HPAE Ranex 3 times a week subcutaneously for 6 weeks, whereas the placebo group, including 21 CFS cases and 18 ICF cases, received normal saline. At the end of study period, CFS subgroup, FSS Fatigue Severity Scale, BAS Visual Analog Scale, and MFI Multidimensional Fatigue Inventory scores were significantly decreased in the HPE group as compared with placebo group in the case of the CFS subgroup. Next, cardiovascular abnormalities. Postural orthostatic tachycardia syndrome, POTS. Viral infection has previously been shown to precede POTS, and with the SE2 receptor expressed on neurons, viral infection by SARS-CoV-2 may have direct negative consequences on the autonomic nervous system. A complex combination of infection and autonomic nervous system-induced pro-inflammatory response and the level of autoimmunity may all contribute to the establishment of autonomic dysfunction and POTS. As described in the papers here, such as placenta extract has a modulatory effect on autonomic nerve activities, and placenta extract has anti-inflammatory properties and antiplatelet aggregation activity, and placenta extract has immunomodulating potential. Placenta extract has various activities. Therefore, placental therapy might be a promising treatment option for improving cardiovascular abnormalities of post-acute COVID-19 syndrome. Next, cognition and mental health. A common persisting symptom regardless of severity of the acute stage of COVID-19. Sleeplessness is also commonly reported following recovery from COVID-19, with many studies finding poor sleep quality and sleep disturbances to be frequent following recovery from acute illness. As I mentioned my another presentation, the PPE group had significantly deeper subjective sleep and a higher sense of sound sleep compared to the placebo group. Therefore, placental therapy might be a promising treatment option for improving sleeplessness of post-acute COVID-19 syndrome. For the future, I am sure that our joint constructive and systematic work will help many patients. That's all for my presentation. Thank you for your attention. See you soon after this pandemic is over.